Welcome, friends, to Jenny's Gems. Today we have a fascinating guest who's going to share what may be one of the most significant developments in healthcare and wellness delivery that I've come across in a very long time. And let's be honest, we could all use some good news when it comes to healthcare. Now, I know what some of my regular listeners are thinking. Jenny, since when did you become a healthcare expert? Fair question. Most of you know I usually spend my time talking with guests about very different topics, but every now and then something comes along that is simply too important to ignore. When I learned about what we're discussing today, I felt it deserved a spotlight. So without any further delay, welcome, Joel Ward.
Hey, thanks so much for inviting me, Jen. I agree. What we're going to discuss today is something every employer and frankly every employee should know exists. I don't say this lightly, but I believe we're witnessing a meaningful evolution in how healthcare benefits can be delivered and accessed in America.
Well, that's certainly not a small claim. You had me at meaningful evolution, but you may have already triggered my skeptic alarm.
I want to say something to both employees and employers. Jen, put yourself in both sets of shoes for a moment. Most of your listeners are probably one or the other. As an employee, imagine looking at your pay stub and discovering your company just gave you access to unlimited primary care, urgent care, mental health services, and other health care benefits with, are you ready? No deductible, no copay, and no reduction in your take-home pay.
Wow, I would...
Hold that thought. You might be excited, but more likely you're skeptical. Now, let's put on the employer hat. Imagine reducing your organization's healthcare spend by 19 to 33%. Imagine reducing absenteeism by 43%. Imagine a workforce that's 2.5 times more productive, more engaged, and actually happier coming to work. And now imagine those improvements aren't being funded by writing a bigger check every month, but are instead supported by payroll tax savings.
Okay, wait a second. You've just thrown out enough claims to make my skeptic alarm start flashing again. But before I go further, Joel was kind enough to give us some graphics we can throw up on the screen, such as those statistics he just rattled off. And if you're just listening and not watching the video version of this, don't worry. He promised he won't show an image that he doesn't also talk about.
Yep, that's the deal.
Okay, let's go back to the first thing you said. You're telling me there's a program where employees can access all this health care and somehow not see their take-home pay go down? And they don't get billed for it either? Because I have to be honest, that sounds impossible.
That was exactly my reaction. In fact, I was so convinced it was nonsense that I refused to even research it for about 6 months after I first heard about it. I have a fairly extensive legal background, which means I'm professionally suspicious of almost everything.
That might even be the most accurate thing you've said so far.
Fair enough. But eventually, a fellow business advisor kept bringing it up. Finally, I decided I owed it to myself, to her, and to my clients to investigate it properly. And the deeper I dug, the more surprised I became. So yes, it absolutely exists.
Before I ask more about that, and putting on my employer hat for a moment, I was intrigued by what you asked businesses to imagine. Normally, I associate imagination with fantasy novels. You're not pulling those statistics out of thin air, are you? Come on. Lower healthcare costs by as much as a third, cut absenteeism almost in half, employees are healthier, happier, and more productive? Do employers have to relocate everyone to a tropical island to get these results?
Wouldn't that be nice? Unfortunately, Paradise Island relocation isn't included in the program. No, those numbers come from one of the providers we work with that's been tracking actual results over time. And honestly, I've only shared the tip of the iceberg.
Is there actually a name for this thing? Is it insurance, a benefits plan, a healthcare subscription? What exactly are we talking about?
No, it's not insurance. But before we go further, let me mention something that's important. Throughout our conversation, you'll occasionally hear me refer to a recommended provider or provider we work with. The reason I'm not simply naming a company and telling everyone to go sign up is because not every employer is the same. Part of our role as advisors is first understanding the employer, their workforce, and their goals before making a recommendation. With that said, the benefits we're discussing today come from one provider in particular that we frequently recommend when it's a good fit. They've built one of the most comprehensive and innovative healthcare platforms we've encountered. But even then, the recommendation comes after the evaluation, not before it.
So, you're not really selling a specific company. You're helping employers determine which solution is the right fit for their organization.
That's correct. We're advisors first. The provider discussion comes second. The important thing to know for this discussion is what makes it work is the marriage of two things. One is old, about 70 years old. The other is relatively new, less than 5 years old.
Oh no, now you're turning this into a mystery novel. My listeners know I can't resist a good mystery. Are you actually going to tell us what those two things are?
Eventually. But if I tell you right now, I think it'll distract from the bigger story. So let me give you a clue instead.
Okay, a clue to solve the mystery. Here we go.
The old part is a set of laws that have been sitting quietly in the background for decades. The new part is a modern method of delivering healthcare. Okay, Miss Sleuth, how's that for a clue?
That's not a clue. That's a teaser trailer. And now I want to know even more.
Okay, when I say employees can access medical care with no deductibles and no copay, I'm not kidding. And I'm not talking about some vague wellness program where you watch motivational videos and learn to think positive. Although not that there's anything wrong with that. I'm talking about actual medical care delivered by licensed, board-certified physicians and clinicians with extensive real-world experience. United States-based providers, real doctors, real practitioners, real health care. So let me give you a quick glimpse of what members actually receive through our provider. You ready?
I feel like I'm about to hear the infomercial version of healthcare.
Fair enough. Let's see if you still think that after this list. Members receive access to primary care, urgent care, mental health services, weight management, fitness coaching and tracking, wellness coaching, even holistic nurse practitioner support, and over 1,000 commonly prescribed medications at no cost.
Okay, that's a lot more than I was expecting, especially the medication part.
Most people have the same reaction.
And all of that is available without deductibles or copays?
Correct.
That's wild. How is that even possible, Joel?
The secret is efficiency in both access to care and delivery of care. Think about traditional healthcare for a moment. Every brick-and-mortar facility has buildings, leases, waiting rooms, front desk staff, administrative systems, and all the overhead that comes with them. Those costs eventually find their way into the system.
In other words, somebody pays for that fancy lobby.
That's about right. Now compare that to modern telemedicine. More and more healthcare services can be delivered virtually without sacrificing quality. Most people have experienced telemedicine by now, but usually as a one-off visit. What's different here is that the entire experience is coordinated. As necessary, primary care talks to urgent care. Urgent care talks to mental health. Mental health professionals communicate with wellness coaching. Everything works together through one integrated platform. Now, obviously not everything can be handled through a video call.
Right. Nobody's setting a broken leg over Zoom.
At least not yet. But let me give you a statistic that shows just how much healthcare can be delivered virtually.
Go for it. And for what it's worth, I've done a few telemedicine visits myself. They were convenient, but they felt more like isolated events than part of any larger healthcare strategy.
Listen to this. A landmark report of McKinsey & Company, one of the largest consulting firms in the world, estimated that up to $250 billion in the United States healthcare spending could potentially be delivered virtually. And the American Hospital Association, working with health tech company Omada, found that roughly 30% of all healthcare services could be delivered virtually based on clinical feasibility. So let me ask you, Jen, do you know what percentage of healthcare visits are actually being delivered virtually today?
Not a clue. Thinking maybe 5%, 10%?
You're actually pretty close. Despite all that potential, virtual care still accounts for only about 6 to 7% of healthcare visits.
Wait a minute. So you're telling me we've barely scratched the surface?
That's what I'm telling you. McKinsey also estimates that more than 50 million in-person visits every year could still be converted to virtual care if adoption became more widespread.
That's incredible. It's like discovering we built an 8-lane freeway and everybody's still driving on the old 2-lane road.
That's actually a pretty good analogy. And here's where it gets interesting. One provider we frequently recommended has already become one of the leaders in that space with over 5 million members and growing.
Why?
Because they figured out something most providers haven't. They made access simple. No hunting around for specialists, no wondering who to call, no disconnected systems, no claim forms to deal with, no bill to pay. The easier healthcare is to access, the more people actually use it.
Oh, you're getting me excited now. But before we go any deeper into the employee benefits, let me put my employer hat back on for a moment. Why does a business owner care about any of this? What's the motivation to adopt a program like this? And I'm thinking most employers are already spending a fortune on healthcare benefits, even when employees share part of the cost. And while the statistics you mentioned earlier sound impressive, some employers listening may be thinking, okay, but are those just nice-sounding outcomes, or are they actually measurable?
Fair concerns and questions. Let's talk directly to the employers listening. You already know healthcare benefits aren't optional if you want to attract and retain good people. And for larger employers, they're literally not optional. Your premiums keep rising year after year. To offset those costs, many employers move toward higher deductible plans. The problem is that employees respond exactly the way human beings respond. If healthcare becomes expensive to use, people delay using it.
Absolutely. Most people don't avoid the doctor because they enjoy being sick. They avoid the inconvenience and the bill.
Precisely. And when people delay care, small problems become bigger problems. That affects attendance. It affects productivity. It affects morale. And every employer listening knows that's true, even if they've never put an exact dollar figure on it.
So when you talk about absenteeism, engagement, and productivity, you're saying employers are already experiencing the problem. They just may not be measuring it.
That's our experience. But now, here's where we move beyond opinion and into measurable results. One of the most objective metrics we've seen is the reduction in healthcare claims and overall healthcare spending after implementation. Remember that number I mentioned earlier, 19 to 33%? That's not employee satisfaction. That's not morale. That's actual healthcare spend. And that raises a very important question. If employees are accessing more care instead of less care, how can healthcare spending actually go down? And that's where the secret sauce begins. And it also starts answering your question about why the benefits themselves work so well.
Okay, now you've got my attention. I'm holding my breath.
Employees, which includes their family members, are able to access care quickly, and I mean very quickly. Any time of day or night, any day of the year, from virtually anywhere in the world, as many times as they need. No copays, no deductibles, no claim forms, and when that happens, two very important things start happening.
Okay, I think I can guess. People actually use the health care available to them because money and inconvenience are no longer standing in the way. They get healthier because they're addressing problems earlier. And because they're getting care through the program, they're relying less on their traditional insurance plan.
Okay, Jenny, sounds like I've explained it well. And that's why we see employers reporting healthcare utilization reductions of their primary medical insurance or even self-insured plan of as much as 1/3. But here's the real question. What does that actually mean for the employer?
Well, if fewer claims are hitting the primary medical plan, couldn't that eventually save future premiums or money saved right off the bat for the self-insured?
Bingo. That's the whole point. When healthcare claims go down, employers are less likely to see the kind of annual premium increases they've become accustomed to. In some cases, those increases may level off. And believe it or not, one employer actually saw their premium go down at renewal. And for the self-insured employers, they see direct claim savings right on their bottom line.
Now, that's a sentence I don't think I've ever heard before. Good news, your health insurance got cheaper.
Yeah, it's not too common, is it? But when it happens, employers tend to remember it. And that's before we even talk about the tax savings side of the equation.
It almost sounds like employers would want to get rid of the regular medical plan altogether.
Now, wait a minute, not so fast. People still experience serious illnesses, chronic conditions, accidents, surgeries, and emergencies that require hospitals, specialists, and in-person care. Traditional medical insurance still plays a very important role. And legally, this program was never intended to replace existing medical coverage. It's designed to work alongside it. Think of it as filling the huge gap between I need care, but I can't afford to use my insurance. The good news is that the same laws that require it to be an adjunct to existing coverage also create a structure where it doesn't become a new financial burden for either the employer or the employee.
You alluded to this earlier, and honestly, this is where my skeptic alarm started blinking again. How can you offer all this without it costing somebody something? Insurance companies may pay out a lot of money on claims, but somebody had to pay the premium first. Maybe I'm getting ahead of myself. I think you were going to tell us more about the actual benefit.
You're not getting ahead of yourself at all. In fact, what you just said is just what made me skeptical when I first learned about this. Let's just put a pin in the legal and financial mechanics for a few more minutes and come back to them. First, let's talk about the experience people actually have using healthcare today. Let me ask you something. Once you've decided you need to see your primary care physician, how long does it usually take to get an appointment?
In my case, probably 3 weeks, maybe longer if I need a specific doctor.
That's pretty typical, isn't it? And for some people, it's considerably longer. Now compare that to this program. Members can use their existing primary care doctor if they want. They can also establish a primary care physician through the program, or even exclusively through the program. Their choice. And when they need an appointment, the maximum wait is 3 days.
3 days?
3 days.
Honestly, that's almost hard to believe. Most people wait longer than that for a haircut.
And that's one of the reasons utilization is so much higher. When healthcare is actually available when people need it, they use it.
What a novel concept. Make healthcare accessible and people access it.
Okay, let's now talk about urgent care. First of all, 90% of members have been able to access an urgent care practitioner within 3 minutes. I'll repeat that slower. They reach an urgent care doc within 3 minutes. How long do people normally wait at an emergency room or even a traditional urgent care facility?
Whoa, wait. Within 3 minutes? That sounds less like healthcare and more like something you'd see on a microwave dinner box. But seriously, don't even get me started. I've had some horrific experiences. And so often I wasn't looking for major treatment. I just needed a prescription or a quick medical opinion. Instead, I was told I could either wait 3 weeks for my primary doctor or head to the urgent care or the emergency room. I hear versions of that story from people all the time.
I'm sorry, but it's not really funny, is it? My laugh is more recognition of just how many millions of people have experienced exactly what you've just described. I think most of us have. But to be fair, not every urgent medical issue can be handled virtually.
You mean we still can't set a broken bone over Zoom? At least not yet?
Not yet. But do you know just how serious this problem has been and why better access to urgent care matters so much? Listen to this. The National Center for Quality Assurance and several peer-reviewed studies have examined emergency room usage. And I'm about to throw a bunch of numbers at you about that. Not because I expect anyone to memorize them, but because I want you to hear the pattern. More than a quarter of ER visits involve minor illnesses, sprains, strains, and other conditions that don't really belong in an emergency room. Roughly 24% to 40% of adult ER visits are considered non-urgent. And some studies suggest that up to 60% of ER visits could have been handled through primary care if people had timely access.
Wait, 60%?
Yep,
That's not a healthcare problem, that's a scheduling problem.
you're right. And it gets even more interesting. 48% of patients reported having to go to ER because they couldn't get timely access to primary care. 60% said their doctor's office was closed when they needed care, and 54% went because they genuinely believed their condition was too serious for urgent care.
So let me see if I'm hearing this correctly. Millions of people aren't necessarily making bad decisions, they're making the only decision available to them.
That's precisely what the data suggests.
Which means if you give people immediate access to a medical professional, a lot of those expensive ER visits simply never happen.
That's the idea. Extraordinary idea at that, right?
Now my skeptic alarm just got a little quieter.
Good, because we're not done yet. In fact, we've only talked about primary care and urgent care so far. And the personal experience you and others are having is why the statistics make sense. Imagine having nearly instant access to a medical professional 24 hours a day, 7 days a week, from virtually anywhere in the world, for yourself, for your spouse, for your children, as often as you need, and without worrying about deductibles, copays, claim forms, or surprise bills. What's that worth? Now, to be clear, there are still situations where you absolutely need a physical urgent care facility or an emergency room. The good news is that when members access urgent care through the program, they're immediately being triaged by medical professionals who can determine whether virtual care is appropriate or whether they should seek in-person treatment. But amazingly, we've really only scratched the surface of the benefits.
Okay, but before we move on, I want to stay here for a minute because I think this point is bigger than people realize. I was just thinking about how often someone develops a cough, a rash, an infection, or some other symptom that's probably minor, but they don't know that. Their primary care doctor can't see them for weeks. The doctor's office tells them to go to urgent care. Now they're sitting in a waiting room, losing half a day, losing their paycheck for that day, and wondering what the bill is going to be.
You're right on there.
So let's compare this. Primary care access in 3 days or less. Urgent care access in minutes, unlimited visits, family members included, and no out-of-pocket costs to use those services. Am I understanding that correctly?
Yes, you are. And I have to admit, sounds almost unbelievable when you stack it all together like that.
That's because it is unbelievable. Honestly, this may be one of the most significant improvements in healthcare access I've ever heard of.
Think about that for a moment. Logging into a portal and speaking with a physician in minutes, even without an appointment. That changes the entire relationship people have with healthcare. Instead of delaying care, they seek care. Instead of guessing, they ask. Instead of waiting, they act.
Now, if I remember correctly, you also mentioned mental health services and weight management as part of the program.
Yes, members also have access to mental health professionals directly through the platform. That can include licensed psychologists, psychiatrists, counselors, and other behavioral health specialists, depending on the member's needs. And importantly, those services aren't limited to the employee. Their family members can access them as well, as with all the benefits.
That's a benefit a lot of families would appreciate. Honestly, I can relate to this one personally. As a flight attendant, I had access to an employee assistance program, or EAP, through my employer. But I have to tell you, why I appreciated having the benefit available, actually using it wasn't nearly as simple as it sounded. Finding a counselor wasn't immediate. Then there was the billing process. The counselor didn't handle it. I had to contact a separate billing company, create an account, connect everything to the EAP benefit, wait for statements, submit paperwork, and make sure everything was processed correctly. The counseling itself was helpful. The administrative process wasn't.
And that's the very issue. Most employers genuinely want to help their employees. The problem is that many programs create friction. Every extra step reduces utilization.
That's a great word for it, friction.
Yes, friction or resistance. And that's why this next statistic is so important. Traditional employee assistance programs, or EAPs as you called it, typically average only about 2 to 7% utilization. In other words, employers pay for the benefit, but very few employees actually use it.
Having been through that process myself, I can understand why.
Now, compare that to the program we've been talking about. In this program, about 88% of members attend their initial mental health session.
Wow, that's not even the same universe.
It really isn't. And what does that tell us? The challenge was never that people didn't need or want help. The challenge was access. Remove the barriers, and people actually use the care available to them.
That may be one of the biggest themes I'm hearing today. The easier you make healthcare to access, the more people use it.
Agreed.
And speaking of access, can we talk about weight management? Because I have a feeling that's going to get a lot of people's attention.
Weight management is a great way to describe it. It also includes wellness and holistic health support in that category. Whether someone is looking to lose weight, improve nutrition, manage chronic conditions, develop healthier habits, or simply improve overall wellness, there are multiple levels of support available. That can include physicians, nurse practitioners, health coaches, fitness coaches, and even AI-powered coaching tools. For example, a member could receive ongoing guidance on topics ranging from nutrition and exercise to stress reduction and managing anxiety or panic attacks. There's also a fitness tracking platform available to members. And once again, all of these services are included.
Before we met today, I noticed there was also a substantial prescription benefit. Can we talk about that?
Certainly. The pharmacy benefit is one of the most popular parts of the program. Members have access to more than 1,000 common maintenance medications and over 70 acute medications at no cost. Yes, you heard me right. Free. No deductible, no copay, no claim forms, and in many cases, medications can be delivered directly to your home at no charge.
That's a huge convenience by itself.
It is, and it produces measurable savings. The data shows employers often experience an overall reduction in pharmacy spending of roughly 8 to 14%. One case study documented an 18% reduction in prescription costs during the first 4 months. Some individual members saved hundreds of dollars per month, and I know one member was saving more than $700 a month.
That's impressive. And speaking of medications, let's talk about the elephant in the room. GLP-1 medications. They're everywhere right now. Does the program offer peptides like GLPs?
In fact, yes, it does.
I hope it's better experience than some have had. I can actually relate to this personally. A few years ago, when Ozempic first came out, I used it and had very good results. But eventually, my insurance stopped covering it because I wasn't diabetic. Like many people, I started looking at online telemedicine options and compound versions. At first, the pricing looked attractive. Then the cost started climbing. Eventually, I'd find myself looking for another provider, starting over with another consultation, another questionnaire, and another doctor. And honestly, I never felt like anyone was really managing my overall health. They were just prescribing a medication. That's not quite the same thing.
I think that's a very common experience.
And there was always a lingering concern in the back of my mind. Who is actually making this medication? How reputable is the pharmacy? How closely am I being monitored? What should I do to protect muscle mass? What should I be doing to protect bone density? What happens when I take it a long time or even stop taking it? I think those are important questions.
They are, and that's one of the major differences in the approach we're discussing today. When GLP-1 or other peptide medications are medically appropriate, they can be prescribed and monitored through the same healthcare platform we've been talking about. The physician isn't simply writing a prescription and disappearing. They're part of a broader care team. Weight management, nutrition, fitness, wellness coaching, and ongoing medical supervision can all work together.
So the focus isn't just losing weight, it's improving health.
That's really the goal, Jen. And for those using compounded GLP-1 medications, the program works with either name brand versions or highly regulated, compliant compounding pharmacies. Members also benefit from substantially lower pricing than many retail options while avoiding separate charges for ongoing physician consultations and follow-up appointments.
That sounds much closer to what people probably imagine healthcare should look like in the first place.
I think that's a fair observation. Instead of chasing the next prescription, members have access to an ongoing healthcare relationship focused on long-term success.
And honestly, that makes a lot more sense to me. The more we talk about this, the more it sounds like a fundamental shift in how healthcare is delivered. Instead of waiting until people become sick or have a medical crisis, this approach seems focused on helping people access care earlier, more often, and more conveniently. And if people are getting the care they need sooner, it would make sense that claims, cost, absenteeism, and other problems start moving in the right direction.
That's definitely the vision, as well as results we are seeing. And one of the things I find exciting is that the platform continues to evolve. New services and capabilities are constantly being added. For example, home blood testing and even DNA-based wellness tools are being introduced. In fact, depending on when someone is watching or listening to this interview, those services may already be available.
That's pretty impressive.
It is. And honestly, we've covered so much that I'm starting to lose track of everything we've talked about.
Well, I haven't forgotten something. Earlier, I asked the question that every skeptic listening is probably still wondering about. How can all these benefits be offered with little or no net cost to the employee? You mentioned old laws and modern technology. Can you connect those dots for us?
Yeah, that's a fair question. And you're right to ask it. I also want to be careful not to turn this conversation into a graduate level tax seminar.
Thank you. My listeners appreciate that.
The short version is this. There is a modest administrative cost associated with providing the program. That cost helps fund the healthcare services we've been discussing. However, federal laws that have existed for decades allow the value of these qualified healthcare benefits to be structured in a way that creates payroll tax savings for employees. Those savings are typically much larger than the cost of the program itself. As a result, employees experience little or no net cost, and some actually see a modest increase in take-home pay.
Okay, now you've definitely got my attention again.
Mine too, when I first learned about it.
So naturally, my next question is, what are these laws?
That's the point where half your audience reaches for a pillow and the other half suddenly remembers they need more coffee.
Yeah.
The good news is employees, or employers, I should say, don't need to become tax experts to understand whether the program may be a fit. When employers contact us, we gather a few basic facts about their organization and then arrange what we call a discovery call with the provider's specialist. Those experts can go as deep as needed and answer questions from the employer, their CPA, their attorney, their HR team, or anyone else involved in the decision. But before we move on, there's another direct financial advantage that employers find particularly interesting.
Which is?
The payroll tax savings don't stop with the employee. Because of the way the program is structured, the employer's taxable payroll is also reduced. That creates a direct reduction in the employer's FICA tax liability.
And just as a refresher, when you say FICA, you're referring to FICA taxes, which are those mandatory payroll taxes that fund Social Security and Medicare, right?
Yeah, that's right. In fact, many of our clients add more than $500 annually per enrolled employee to their bottom line through the payroll tax savings alone. And that's after accounting for the administrative cost of the program. So in most cases, the program effectively pays for itself. Here's a real-world example. We have one employer with 1,540 enrolled employees. Oh, and by the way, when I say enrollment, that's voluntary.
Wait, I was actually going to ask about that. So employees are not required to participate?
No, participation is completely voluntary. The program operates through a Section 125 cafeteria plan election, which means employees choose whether to enroll. What's remarkable is that nearly 90% of eligible employees typically do enroll.
That's a pretty strong vote of confidence.
I think so too. Now back to the example. That employer of over 1,500 employees is generating more than $82,000 per month in net savings after the program costs have already been paid.
Per month?
Per month.
That's almost $1 million a year.
It is. And while every company is different, employers could use that example to begin understanding the potential scale. Whether they have 25 employees saving several $1,000s or 10,000 employees saving several million, the math could become very meaningful.
That's fascinating. But let me go back to something that's still nagging at me, the payroll tax savings, the employee side of tax savings. This isn't some sort of loophole, is it?
Yeah, that's a great question. When most people hear the word loophole, they're thinking about some obscure technicality nobody intended that might disappear the moment the government notices it.
Exactly what I'm saying. Something that works until somebody in Washington decides to close that door.
Right. That's not what we're talking about. A better term is tax advantage. Tax advantages are provisions intentionally created by lawmakers to encourage certain behaviors. For example, contributions to retirement plans like 401ks and IRAs receive favorable tax treatment because the government wants people saving for retirement. Employer-sponsored health insurance receives favorable tax treatment because the policymakers want people covered by health insurance. The structure we're discussing today is based on laws and regulations that have existed for decades and were specifically designed to encourage employers to provide health care-related benefits to employees. In fact, I should add, medical services are required to obtain the tax benefit, not just wellness programs. Not even offering any form of medical or health insurance under this provision qualifies. It's a very specific structure. There have been some companies that have tried to get away with look-alike programs and have been disqualified for their tax break.
Wow, that seems important to know. So the tax savings aren't an accident, they're a feature.
That's a great way to put it. They're a feature, not a flaw. And very specific at that. What was changed or what has changed recently isn't the law. It's the technology. Modern healthcare delivery systems have finally made it practical to take advantage of provisions that have been sitting in the tax code for many years.
Okay, the healthcare side makes sense. The tax side makes sense. But if I'm a business owner, my next concern is probably implementation. How difficult is it to actually put all of this into place?
Fortunately, it's much simpler than most people expect. There are a few steps, of course, but it isn't a difficult process. Most employers simply want information that's specific to their company, their workforce, and goal.
Which probably means they need to start by contacting you.
Yep, that's where the conversation begins. Whether someone contacts me directly or one of our ESG advisors, the first step is simply a brief conversation. We gather a few basic facts about the organization, the workforce, and what the employer hopes to accomplish. From there, we determine whether this program appears to be a good fit.
Wait a minute, does that mean not every employer qualifies?
No, not every employer will qualify immediately, but I hesitate to list specific qualification requirements here because they can change over time. And sometimes a company that doesn't qualify today may have a very simple path to qualification tomorrow. The important point is this: don't disqualify yourself based on something you heard in a podcast. Have the conversation. It's quick, easy, confidential, and there is no cost or obligation.
I like that. So many people rule themselves out before they even explore the possibilities.
Yeah, I see that a lot. And one thing I want employers to understand is that we're not salespeople, we're advisors, information providers. Our role is simply to help employers understand their options and determine whether a program like this aligns with their goals.
So, what happens after that initial conversation?
If the program appears to be a fit, we schedule what we call a discovery call. That is typically a 30-minute video meeting with specialists from the provider. The employer can invite anyone they want involved in the decision-making process, including owners, executives, HR personnel, financial officers, anyone they feel should be there. The purpose is simple: learn how the program works, ask questions, and determine whether it's worth exploring further.
That's it?
That's it. Nobody's expected to make a decision on the call. Nobody's pressured. The goal is education.
I have a feeling that some employers listening are wondering what happens when they hand this information to their CPA or attorney.
Yeah, they should. In fact, we encourage it. Many employers involve legal counsel, CPAs, benefits consultants, or other trusted advisors. That's healthy. It's what responsible organizations should do.
And how do those professionals usually react?
The same way I reacted when I first encountered the program, with skepticism. And frankly, that's their job. The encouraging thing is that after they examine the structure, ask questions, and review the supporting documentation, they often walk away impressed by how well established the underlying laws and regulations actually are.
That's reassuring.
Yes, as it should be. And it's worth remembering that this isn't being used only by small employers. The providers we work with serve organizations ranging from small businesses to local governments, large corporations, labor organizations, and even professional sports organizations.
Can you give any specific examples?
Most organizations understandably prefer not to become public case studies. However, one example that was publicly announced is the New Mexico Coalition of Educational Leaders. In March of 2026, they publicly endorsed our top provider for educational leaders and school employees throughout New Mexico. Organizations of that size don't make decisions lightly. They perform extensive legal, tax, financial, and operational due diligence long before moving forward.
That's a pretty strong endorsement. So let's say an employer completes the discovery process and wants to move forward. What happens next?
At that point, the employer is typically asked to provide a basic employee census. No employee names are required. No private medical information is required. The provider uses that information to prepare a customized proposal tailored specifically to the organization.
And then the employer starts seeing all the details.
Yes. Implementation timelines, documentation, compliance support, employee communications, enrollment processes, everything needed to make an informed decision.
Sounds pretty turnkey.
It really is. In fact, one thing employers are often surprised to learn is how little administrative burden falls on them. The provider handles the compliance documentation, educational materials, enrollment support, and ongoing administration.
Before we wrap up, let me see if I can summarize what I've learned today. Employees gain easier access to healthcare. Employers gain a healthier and more engaged workforce. Organizations reduce healthcare spending and payroll taxes. And both employers and employees can potentially benefit financially while improving access to care. Did I miss anything?
Only one thing. It costs nothing to find out whether it's a fit. No obligation, no pressure, just a conversation. And one more thing. If you're already working with an ESG advisor, simply reach back out to that person and they'll guide you through the process. If you don't already have an advisor, we'll connect you with one best suited to your organization and needs. The important thing is simply to start the conversation.
That's fair. And honestly, after everything we've discussed today, I think that's a conversation many employers should at least have. So let's put the contact information on the screen. The website is employerstrategygroup.com/contact. You'll also see a QR code that takes you directly to the contact page. And let me suggest, if you're an employee and would like your boss to consider the program, as I know I would, you can also contact ESG to arrange for your company to learn more about it. Is that right, Joel?
Oh, yes, absolutely.
Joel, thank you for joining me and helping us understand what may be one of the most significant changes in employee healthcare delivery that I've encountered in years.
Thank you so much, Jenny. I truly appreciate the opportunity. And to everyone listening, thank you for spending time with us today.